Okay. Can everybody hear me? I can't tell if it's working all the time. I think it's not. Number one question from 4 people, and actually I was going to mention this if someone hadn't asked. But basically, who wrote this bill? I mean, how do you get a bill like this? This is boilerplate. I read all of H.R. 3200, all of H.R. 3962. That was 1,100 pages, 2,000 pages, and all the Federal Register executive branch stuff by mid-2010. That was over 350 pages. And after a while, I started to think I was reading the same thing. So I took some sections out of one bill, 3200, and placed it in a document and searched for it in the other one, and found out paragraph after paragraph was just placed in other bills. I've noticed that even in non-healthcare bills, some of the boilerplate that's in there is in other healthcare bills. Well, what do you mean, Dr. Berg? Well, do you think that taking over the student loan thing has anything to do with healthcare? And that's in that. That's boilerplate. That's been written. Basically, someone said, how can you do all that? Well, it's been written for over 10 and 20 years. It's just been modified. It's funny when I do these searches on it to prove it, the only thing that's different, there is some difference, you know what it is? It's the numbers of the section that it's in, because it has to fit in. It's really amazing. These things have been going on, written by leftists, and this has got to be a team of literally thousands of people working full-time for decades. How could they have written a 2,700-page bill in less than 6 months? They didn't. Okay, another thing is, if doctors refuse to accept Medicare patients, basically what's going to happen? Well, it's interesting. How many of you heard that Massachusetts had a mandate like this and it was similar to Obamacare? Obama's saying he's just copying that, and that was a Republican idea, so it's all okay. Well, since that was instituted, Massachusetts has been losing hand over fist money on that program. It's cost more than 8% more per year, which is higher than it had been going up before. So finally, and the doctors are dropping it because the government of the state of Massachusetts has been cutting back on the amount of money they're getting paid to the doctors. Obviously, they got to cut. So the doctors are dropping out. So, in fact, the people cannot find health care. Exactly what this person said. You know what Massachusetts' answer is to this? It's the answer that I told my wife a year before they did it would happen on a federal scale. They are going to tie your licensure to be a doctor to you taking those patients. The bill is out there. I don't think it's been passed because I haven't seen that it was. It's less than a year old. And it basically ties licensure to CN patients. If you see one patient, you want to keep one patient, a friend, that's on the government plan, you must see everybody under the government plan or you lose your license. Licenses are state issued. The same thing will happen in the federal government. Will doctors become employees of the federal government? Well, it didn't say in there, did it? Not to be mean to whoever wrote it didn't say that, no, but you understand, you can get the flavor of what's there. It didn't say they're going to make, but who are they going to work for if there's no insurance? Who are they going to work for if Medicare goes out and Medicaid, because it pays nothing, so no one takes it, so it finally implodes? Where are the doctors going to go? Well, to the government health care.
Where are they going to get their money?
Right, right. How does this affect existing conditions? Talk to me. I'll talk about the comparative effectiveness research. GE going to be a big winner? This person must know something. GE is in the pocket. For many years, I told my wife and did some study 7 years ago when I set up my first practice in family practice, and they are in bed with the government big time for the kickbacks and the favors they get back and forth. If you want to see the best example of crony capitalism, look at GE. Okay. All right, I'll get to some more questions later. Let me go on, because it sounds bad. Can we do anything about it? Well, yeah, the doctors are, and I believe this, the doctors really have the patient's health at heart. I really think they do, in general. Just like most postal people don't go postal. But, you know, so they'll probably protect you, right? I mean, the government is not going to make you do these things. Like you said, it doesn't say you have to be a federal employee, does it? So can they really make you do it? Well, does anybody remember Gilligan's Island? I was real little when I watched that. It wasn't in my 20s, but Gilligan said, you can't make me, you can't make me, you can't make me. And then they dressed him up as a baby or something in diapers, I forget. But yeah, they made him. So if you're a patient, then the government says, yes, we can. Here's what the secretary may do. She may do it. It's up to her discretion. She can use evidence of findings from research to make a determination regarding Medicare coverage. Now, what research is she going to use? The research she funded and approved at the very beginning. She can modify the coverage of any prenatal service or preventive service if it's consistent with the United States Preventive Services Task Force recommendations. Do you realize the United States Preventive Task Force is a service that's within a bunch of offices that are under the HHS, Health and Human Services, run by Kathleen Sebelius. She's the secretary, and when I say secretary, I mean the secretary of HHS. HHS includes the CDC, the NIH, the National Health Research Council, Office of Minority Health, I believe, is in there. I have a slide later from my own program. There's about 11 other things. So if you think it's the CDC's doing the best for you, or the NIH, National Institute of Health, who's just doing the best research for you on its own, it's a subcategory of the HHS. Okay. Now, if you're a patient, they can say, yes, we can. The secretary shall do this to you. Award grants to states to provide incentives to Medicaid beneficiaries to encourage your behavior modification. In other words, the government funds state programs that then work at psychologically getting you to change your behavior.
Does that include eating broccoli?
Food is in there. My wife's a dietitian. She can fill you in on a lot of it. Personalized prevention plan services with a grade A or B will have no co-insurance. Well, the thing is, that's not forcing you anything, but that's incentivizing. They're telling insurance companies that they can't charge you a co-insurance for that, so you pick that particular grade A or B Preventive Health Service Task Force recommendation. But guess what? They do the rating. The secretary may, now if you're a physician, I love some of this stuff. The secretary may provide education and training to physicians in pain care, but only if you include culturally linguistic and literacy geographic stuff in your, to figure out in your underserved areas. Make sure you're doing it right with the underlying agenda that we give. Or we don't pay it. Provide that physicians receive no payment for preventive services not receiving the grade of A, B, C, or I. I don't have to explain it. It sounds like that's a lot of grades, and it's fine. He can do a lot. Well, if he could do everything he wants to, why would that be written in there? The thing is, I put it under physicians because do you think, as nice as I think doctors are, that they're going to say, well, I'm not going to get paid if I order this, and you'll have to pay it, but you know what? I have to make you fill out a legal form ahead of time if it's not covered, and this is true. If it's not covered, I have to explain it to you and have you sign it, that you understood it wouldn't be covered, etc., and that you could go somewhere else and you didn't have to pay for this, and you could bolt right out the door because you didn't know that, and you didn't want to stay and you're pissed off. Yeah. But, so do you think now the doctors are going to say, by the way, I really can't do that. Do you think I should? They're not going to give you the choice. In other words, you don't get a choice. Why do you think the doctors are the target of a lot of this? It's not because Dr. Berg is paranoid or loves medicine so much. It's because that's where the money is. And that's where the money can be taken away from. And that's control. Yep. The secretary shall innovate reporting quality measures with EHRs and claims data. The secretary shall use claims data Claims data is stuff that they put in there to get paid, so your insurance company knows they'll pay it. That means they have to have enough insurance information on you. This claims data isn't something about Dr. Berg went to school in 1984. This is information on you. It would normally go so your insurance company pays me, but now it goes to wherever the government wants it, for anything. For a physician, yes, we can make you do it. If the Medicare physician does not satisfactorily submit the data, then pays decreased to 98%, 0.5 in 2015, and 2016 after it's 98% of the minuscule amounts that it already is. It's paying less than it did, Medicare is, in real dollars than it did in 1995. No, physician must use a certified electronic health record which reports quality data, otherwise he will be penalized. But if for some reason it's not right, or the secretary just says you didn't report enough, because we haven't updated the HR as yours is a year old, you didn't report enough, then it doesn't matter if they report everything else. Didn't report enough for you to get paid.